Have you been getting symptoms while you're fasting and just don't want to even continue doing fasting because all these symptoms are just driving you nuts? Well, I'm going to explain how to be able to prevent from getting those symptoms, and if you are experiencing those symptoms, what to do during the fast. So stay tuned right after this intro. What's up, my health enthusiasts? Today is Thursday. You know what that means? That means it's a fasting video. Every Thursday I fast, and so therefore we do a fasting video every Thursday. So if this is your first time on our channel, go ahead and consider subscribing by hitting the subscription button and also hitting the notification bell so you don't miss any of upcoming videos. And then every Monday we do some health tip videos. So, how about any of you guys? Are you guys fasting today? Go ahead and leave that in the comment section below, just to kind of have this movement of, trying to do every Thursday, doing a good water fast. But today we're going to talk about how to deal with symptoms with fasting. So one of you guys asked the question, JK asked a question specifically for his wife that deals with issues with fasting and getting headaches, which is a very common symptom. So JK, thanks for asking the question. And so just to answer that question is when it deals with fasting, especially with headaches, nausea, and vomiting, lightheadedness, those are very common symptoms. I experience those symptoms all the time, even been an experienced faster. And I know reasons why I usually will get those headaches because there's certain things I've not implemented before I start doing a fast. So if you think about fasting in general, especially when people are starting to do intermittent fasting, a good thing to do is try to treat fasting like if you were trying to train for a marathon. You wouldn't typically go, if you've never ran before, go and do a marathon right away. That would just kill you. It's the same concept with fasting. You don't want to just jump in doing a long extended 7-day fast. That is just going to be really detrimental to your body unless you've prepped your body. So some people do really well on doing extensive fast because they prep their body. So good things to do to prep your body is one, starting to eat a more whole foods plant-based diet, or just a whole foods diet, some good meats and good vegetables and fruits, just getting some good whole foods versus a lot of packaged and processed foods to be able to start doing that. Another good thing is also to decrease the carb intake that you're doing. So a lot of people who do the keto diet tend to do really well with fast because they've decreased a lot of the carbs out of their diet and they're already putting themselves in a ketosis or ketogenic state, and that really is what fasting does. So their body's already prepped for that. Now another great thing to do is before you decide to do a long extended fast is start doing intermittent fasting. So start just by eliminating, the window frame by eating an 8-hour window frame every day, or, start skipping breakfast. And so you're slowly getting your body adapted to it. And then you start moving to finally doing a full 24-hour fast. It's just like if you were training for a marathon. You just do it little bit by little bit. You don't go and run the full 10 miles. You start with running 1 block, 2 blocks, so forth. So the same with fasting. You slowly introduce it to your body so that when you start to doing the long-term 7-10 day fast, your body is ready for that. So some ways to actually prevent headaches or even just nausea, vomiting, and even lightheadedness during a fast is what I've mentioned before, is before you did the day before you're doing a fast, or even a couple days before you're doing a full 24 or 48 hour fast, you want to be able to eliminate the carb or sugar intake. I know from my experience when I've done like kind of more of a feasting day and there's a little bit too much carbs in my diet and then I do an extensive 24 or 48 hour fast, I'll tend to have those headaches. And a lot of times I'll have to break the fast early. Now what you need to do when you need to break the fast early, when you're starting to have those headaches that you just can't handle it. And trust me, I've been there multiple times where I just I got a lot of work I need to get done and these headaches are just driving me bonkers. What you have to do is just start taking some things, for me, usually is an electrolyte deficient, so sometimes doing something like an avocado with a little bit of sea salt, or even like a steamed sweet potato with a little bit of sea salt, or even doing some herbal drinks that can help. But usually you just need a little bit of electrolytes back in your system to kind of help alleviate those headaches. But instead of just going and eating a big, Big Mac or some kind of big meal, you want to be able to still get those benefits from at least how long you did that fast, whether it's 24 hours, 36 hours that you did before you needed to break it. So just make sure you kind of first take something that has a little bit of salt, a little bit of healthy fats, or even doing like olive oil with some maybe small potatoes and some sea salt, something that can kind of help with those symptoms, and then slowly taking and going back to the food you're eating. Another great thing you could also do is also even veggie broths. Veggie broths are great, or even bone broths can be another great way to kind of start breaking the fast. Another very common symptom is food cravings. I know everybody's experienced this. I'd be surprised if nobody experienced food cravings when they are fasting, or even doing intermittent fasting for that matter. It takes a while to get adapted to the use of the idea. Now, people who are doing long extended fast, they will usually experience after about 3 days that they won't feel hungry anymore. They're kind of get over those food cravings. But best ways to actually avoid food cravings is, especially if you're doing a long-term fast, for 7 days or how long you're planning on doing a long-term fast, is to be able to eliminate TV. Now why I say that is because if you've ever done a long-term fast, I know I have, if I am watching TV, there's lots of great commercials with nice foods of galore that you want to eat. You want to eat everything. You feel like everything that you're exposed to has food. You start dreaming about food. You start eating a nice big juicy hamburger, and then you feel guilty in the morning thinking that you ate that. But really trying to avoid any kind of exposure, whether it's commercials, Facebook, trying to eliminate that can really help with the cravings. The other thing that you can do is making sure that you're drinking adequate amounts of water throughout the day. Can help your stomach be at least somewhat full and satiated. But also even you could do herbal teas that are not caffeinated, but more herbal teas can also be another great thing that you can do. But you'll eventually get past that. It just takes a while for your body to kind of get past that. But the other thing to keep in mind, somebody also asked this question of, when do you know your body needs to break a fast? It's a great question. In fact, usually in most cases, your body will tell you when you get an extreme hunger. So if you're doing an extended fast, you'll hit that point where your body is just all of a sudden experiencing extreme hunger. Like for a while, you're like, oh, I'm not hungry anymore. I'm not thinking about food. And then all of a sudden you hit this point where your body just has extreme hunger. That's when your body's really telling you, okay, it's time to start breaking off the fast. So that's just a good tip to kind of be more in tune with your body when it comes to breaking off the fast and knowing when to. Another common symptom that you can experience during fasting is cardiac arrhythmia or heart palpitations. In fact, I had a patient that experienced this recently where she was experiencing a little bit of heart arrhythmia and heart palpitations. And this is very common because when you're going through a fasting state, you can get really depleted in lots of different minerals, magnesium being one of them. So if you're experiencing this, you want to start taking some supplements such as like magnesium to really help, or some maybe a little bit of calcium, things that, or even potassium that you might be depleted in, some electrolytes to really help calm down the heart palpitations. If they're persisting, I recommend you definitely need to get off the fast, and if it even keeps on persisting even longer, don't hesitate going seeing the doctor, because this can be a big concern. It's very rare that it happens, but it does happen for people, and I've had some patients that it has experiences. But by adding magnesium and some other electrolytes has helped alleviate the symptoms for that patient. Another common symptom is that you can experience sudden blood pressure drop. Now, for people who have high blood pressure, this is great, but for somebody that has low blood pressure to start with, they can get sudden drop of blood pressure when they're doing fasting. And so what I recommend if you are experiencing severe lightheadedness, now the problem with having lightheadedness during a fast isn't having that experience, but having falls where you're fainting and hitting your head. That can be a common concern. But so if you're starting to feel lightheaded, having low blood pressure, you need to be careful when you're getting up and moving slower, resting a little bit more. But even if you're experiencing really severe lower blood pressure, you want to be able to kind of start coming off the fast sooner rather than later. Another symptom that you can experience is severe abdominal pain, or just abdominal pain in different parts of the body. One that's very common is, your gallbladder, where maybe the gallstones can be activated where you're having a severe pain, or other issues in the abdominal area. Now, if you're experiencing this, again, the rule of thumb is if it's lasting more than 48 hours, you definitely want to really stop your fast and start breaking off of it. And I've talked about previously in this video how to break that off. And another very common symptom is muscle spasms, or also seeing a depletion in your potassium levels. Now, you only can really measure this if you do a blood work, which is actually pretty inexpensive type blood work. It's a comprehensive metabolic panel where you can measure your potassium levels before and after or during the fast. But usually if your potassium levels are dropping 3.0 millimoles per liter or rising above 5.5 millimoles per liter, that is a concern where you definitely need to start coming off the fast, because with those you could experience severe fatigue, weakness, muscle spasms, lightheadedness, weakness in the brain fog. You can experience all these different kinds of symptoms when you're experiencing very low or elevated potassium levels. And you would have to obviously have your doctor measure these types of blood levels for you while you're on the fast. But what you can do is you obviously want to supplement potassium levels if your potassium levels are really low. And then even just with dealing with the muscle spasms, some things that you also can do that can help with the muscle spasms is supplementing magnesium and other electrolytes that can help with those muscle spasms. Now, I don't have time to go over all the different symptoms you can get from fasting. I just want to kind of go over the big common ones. And another one is, of course, with fatigue and weakness. This is common for people who are doing an extended fast. People who are doing intermittent fasting won't really experience this that much, especially because they are only doing a short time of fasting. But doing an extensive 7, 5, 10-day fast, you will experience this weakness. And I don't really recommend doing exercise if you're first doing these kind of fasting. Your body needs to rest because it's really going through a big process of really detoxifying the body. So you want to be able to rest. Allow your body to sleep. If you feel like you need to be sleeping more while you're fasting, do it. Your body is needing it, so making sure that you're doing that when you are fasting. Okay, so I hope you guys liked this video. Go ahead and leave a comment down in the comment section below if you have any more questions about fasting symptoms or any other kind of fasting questions. And then, of course, if you guys like this video, give us a big thumbs up, share with your family and friends. And if this is your first time on our channel, go ahead and hit that subscribe button over here. And then I will leave some other videos that you guys can watch on fasting if you have not seen those already. Okay, guys, love you guys, and thank you always here at Fasting Thursdays. I will see you until next time. Thanks. Bye.